Hi, so today I'm going to be talking about my infographic on ovarian cancer and your microbiome. So, since the microbiome is a new topic of research that has just emerged within the past 10 years or so, many people don't think to associate their microbiome with cancer, but today I'm going to be talking about why you should associate your microbiome with cancer, and I'm going to be specifically talking about ovarian cancer as it is located where a majority of the bacteria in your body do hang out, as well as many people call it the silent killer of gynecological cancers because many people don't know how to detect it and symptoms are hard to find. So I'm kind of trying to bring more awareness to that. All right, so I know a majority of this class is highly dominant in girls, so this does directly apply to you, but if it doesn't directly apply to you, it more than likely applies to someone in your life. So you can use this information today to educate yourself or other people around you on the ovarian cancer and your microbiome. I'm also going to mention that all of the information today that I'm using can be found on .gov or .org sites, as well as PubMed, and all the citations will be at the end of my infographic. All right, so what are the main points today? First, I'm going to talk about why it is thought to be the silent killer. As you can see right here, I include that in kind of my hook of the infographic. We'll be getting into that later on, but I just wanted to point that out. Also, my other hook that I use is, did you know the billions of bacteria in your body may help to reduce your risk of cancer, ovarian cancer, excuse me. And we're going to be talking about that later on in the infographic as well. Also, we're going to be talking about the demographic of people that ovarian cancer statistically occurs in. And then secondly, we're going to be talking about what your microbiome is, where the location is, and what it does. Thirdly, we're going to be covering inflammation, cancer, and your microbiome, how all of these kind of interplay with each other. And lastly, we will be talking about what you can do to keep your microbiome healthy and avoid inflammation. Right, so let's get on with the first topic. I'm just going to cover some quick facts. So, many women don't know that ovarian cancer is in their bodies until it is too late. This is because ovarian cancer shows close to no symptoms at all, even when it's progressed into its later stages. If any symptoms are being shown, they can be easily mistaken for premenstrual syndrome or the common urinary tract infection. These symptoms do include abdominal pain or pelvic pain, such as bloating or pressure. Also an increased abdominal size, although this is usually when the cancer has progressed into its later stages, as there is a fluid buildup around the tumors. Next, the need to frequently urinate is often a symptom. Feeling full after eating less than usual, appetite loss, indigestion, and irregular bleeding. Many of the symptoms could easily fall into other symptoms that women can get due to other gynecological problems that don't involve cancer, and this is why women aren't usually tested for ovarian cancer. Okay, so the demographics that I will be covering are, so starting off here, 63 is the median age of women diagnosed with ovarian cancer, and this is statistically speaking. So usually ovarian cancer occurs in women starting at about or around the age of 60. And of these women, around 21,750 women were estimated to be diagnosed with ovarian cancer in 2020. All right, and so 47.6% of women will survive after 5 years of being diagnosed. Now, this may sound like a decently high survival rate of 5 years, but when you compare it to invasive breast cancer, the 5-year survival rate for women diagnosed with that is 91%. And so when you compare those two, they are drastically different from each other. So I believe that hopefully this will change within the upcoming years. And if you're really interested on these statistics, you can find these survival rates on cancer.org under both invasive breast and ovarian cancer. All right, so on to my second point. What is the microbiome? So your microbiome is a community of organisms that are within your body that inhabit different environments. So it sounds pretty complicated, and that is because it is pretty complicated, but there are some key functions that are easy to understand, and I will explain those to you in this presentation. So many people associate the location of the microbiome to be solely within your gut. And this is true. About 95% of your microbiome is in your gut, but the other 5% can include your stomach, your genitalia, your nose, mouth and throat, and skin. So it is essentially in every part of your body. All right, and then this gathering of trillions of bacteria in your body, they do specific things to keep you healthy. And now, I know bacteria are usually associated with bad thoughts, but there is such a thing as good bacteria. These bacteria in your microbiome are the good guys. They're considered the good guys because recent studies, as I point out right here, suggest that the microbiome plays a large role in immune system health by blocking inflammation. And they have also been shown to communicate with your brain. And this is kind of cool because your microbiome relays information from your body to your brain, kind of pointing out if there's any foreign bodies hanging out anywhere, or if your body needs to prevent any sort of disease. So it's really important to keep your microbiome healthy. That way it can do this. And then, sorry, I lost my place. So I'm going to move on to inflammation, your microbiome, and ovarian cancer. So inflammation is, known to largely contribute to cancer. So a cancer tumor is essentially inflammation within your body. And your microbiome are the guys that help keep your body from becoming inflamed by, directly being in relation to your immune system. They send signals to keep everything in control, and when the health of your microbiota are compromised, then they don't do a good job at keeping this inflammation under control. And inflammation of the genitalia microbiome can therefore directly contribute to the formation of invasive tumors, especially in the ovaries. So, what can you do to keep your microbiome healthy? In order to avoid inflammation. So, number one, eat fermented foods such as sauerkraut, kefir, yogurt, etc. These foods have a lot of healthy probiotics which protect the healthy microflora living in your body. And they curate a supportive and healthy environment for these good guys. And they are essentially live organisms that give that extra boost. So you want to make sure you eat plenty of those to keep everything functioning really well there. And then second, you want to avoid antibiotics. As it says in the word, it is antibacteria. And although antibiotics do kill bad bacteria, they also sweep out those good bacteria in your body. So you want to make sure that if you are planning on taking any antibiotics, make sure that you replenish those healthy bacteria in your body by eating probiotics. Because I know that, antibiotics sometimes are essential and you can't really avoid them. All right, so Thirdly, make sure to eat plenty of fiber to allow your digestive system to take care of waste efficiently. And this is important because when you think about it, fecal matter contains E. coli, and E. coli is a bad bacteria. And when a bad bacteria stays in the body for too long, it can compromise the functions of the good bacteria. And when this happens, then the good bacteria in your body don't work as well as they should. So to do your best, uh, um, do your best. So do your best at keeping your digestive system working normally and efficiently. And fiber can be found in all fruits and veggies, so make sure you keep that up. And you should be good there as long as you have normal bowel movements and all of that fun stuff. All right, and my last point is, and it's probably my most important point, don't hold on to stress, because believe it or not, stress causes a large amount of inflammation. As I talked about earlier, inflammation can easily lead to disease. When cortisol levels are constantly high in your body, inflammation becomes a response. Stress leads to a breakdown of the immune system, and as we've talked about, the microbiome is directly related to the well-being of your immune system. This has a negative impact on the functioning of all those bacteria in your body. So since our mind is so closely related to our gut, you have large amounts of stress that can kind of be transferred from your brain to your gut. And they're held within this area, kind of in the pelvis. So it's not surprising that ovarian cancer can be a result of this. All right, so make sure, just to, whenever you're stressed out, just do something that relieves your stress a little bit. Exercise, things like that. Eat healthy, all the basics. All right. So one last time, I kind of want to go over everything that we've covered in this presentation. So we talked about the symptoms of ovarian cancer, as well as the demographics of people that are most likely to get it. We talked about what the microbiome is, as well as where it's located and all of its functions. We talked about how inflammation, your microbiome, and cancer all play into each other. And then we discussed what you can do to keep your body healthy, your microbiome healthy, and how to prevent inflammation. And remember that the healthier your microbiome is, the more prepared your body will be to fight off gynecological cancers, as well as many other types of cancers. And that's all I have. So thank you for joining me, and I hope that you all now understand the relationship between ovarian cancer and your microbiome. Bye.